We are constantly bombarded with news about viruses. It seems like every few months there's a new one making headlines. Today we're talking about a virus you may not have heard much about, Human Metapneumovirus or HMPV. Many people are surprised to learn that HMPV has been circulating for quite some time. It was first discovered in 2001, but researchers believe it has likely been causing respiratory illnesses for much longer. The reason it's gaining attention now is due to a recent uptick in cases, particularly in certain parts of the world. Understanding HMPV is crucial because it often presents with symptoms similar to the common cold or flu. This can make it tricky to diagnose and differentiate from other respiratory infections. By the end of this video, you'll be equipped with a solid understanding of HMPV, its symptoms, and most importantly, how to stay safe. So let's dive in. HMPV stands for Human Metapneumovirus. It's a respiratory virus, which means it affects the lungs and airways. HMPV is part of the Paramyxoviridae family, a group of viruses that also includes the viruses responsible for measles, mumps, and RSV. HMPV was first identified in the Netherlands in 2001. Researchers discovered the virus while investigating a group of children with respiratory illnesses that couldn't be attributed to any known viruses at the time. HMPV is highly contagious, spreading through respiratory droplets released when an infected person coughs or sneezes. It can also spread through direct contact with surfaces contaminated with the virus, such as doorknobs, toys, or utensils. While HMPV can infect people of all ages, it's particularly common in young children, older adults, and individuals with weakened immune systems. Now that you know what HMPV is, let's talk about its symptoms. HMPV typically causes mild to moderate respiratory illness, often resembling the common cold or flu. Symptoms usually appear 3 to 6 days after exposure to the virus. One of the most common symptoms of HMPV is a runny nose. Along with a runny nose, many people also experience a cough, which can be either dry or productive. HMPV can also cause other cold-like symptoms such as congestion, sore throat, and fever. Fever, a temporary increase in body temperature, is another common symptom, especially in young children. In some cases, HMPV can lead to more serious complications, particularly in infants, older adults, and people with weakened immune systems. These complications can include bronchiolitis, an inflammation of the small airways in the lungs, and pneumonia, an infection of the lungs. Signs of these more serious conditions include difficulty breathing, wheezing, rapid breathing, and chest pain. Recently, there has been a notable increase in HMPV cases in certain parts of the world, including India. This surge in cases has raised concerns among health officials and the public alike. Several major cities in India, including Delhi, Mumbai, and Bangalore, have reported a significant uptick in HMPV cases in recent months. The Ministry of Health and Family Welfare has issued advisories to hospitals and healthcare providers, emphasizing the need for heightened surveillance, early detection, and appropriate management of HMPV cases. They have also launched public awareness campaigns to educate people about the virus, its symptoms, and preventive measures. While the recent rise in HMPV cases might seem concerning, there are several practical steps you can take to protect yourself and your loved ones from this virus. These preventive measures are simple yet effective in reducing the spread of HMPV and other respiratory infections. One of the most crucial steps in preventing the spread of HMPV is practicing good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating, and after using the restroom. If soap and water are not readily available, use an alcohol-based hand sanitizer. Avoid close contact with people who are sick, especially if they are exhibiting respiratory symptoms. If you are sick, stay home from work or school to prevent spreading the virus to others. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze to prevent the spread of respiratory droplets. Regularly clean and disinfect frequently touched surfaces such as doorknobs, light switches, phones, and toys. There is currently no vaccine available for HMPV. Until a vaccine is available, practicing good hygiene, avoiding close contact with sick individuals, and maintaining a clean environment remain the most effective ways to prevent HMPV infection. As we navigate the world of respiratory viruses, it's essential to differentiate between various illnesses. HMPV and COVID-19 are both respiratory viruses that can cause a range of symptoms from mild to severe. However, they are distinct viruses with important differences. One key difference lies in their symptoms. While both viruses can cause cough, fever, and shortness of breath, COVID-19 is more likely to cause loss of taste or smell, a distinctive symptom not typically associated with HMPV. Additionally, gastrointestinal symptoms like nausea, vomiting, and diarrhea are more common in COVID-19. The incubation period, the time between exposure to the virus and the onset of symptoms, also differs. HMPV typically has an incubation period of 3 to 6 days, while COVID-19 can have a longer incubation period ranging from 2 to 14 days. In terms of severity, both HMPV and COVID-19 can cause mild to severe illness. However, COVID-19 has been associated with a higher risk of severe complications, including hospitalization, long-term health issues, and death, particularly in older adults and individuals with underlying health conditions. There is no specific antiviral treatment for HMPV, and management primarily focuses on supportive care such as rest, fluids, and over-the-counter medications to relieve symptoms. Understanding the differences between HMPV and COVID-19 is crucial for seeking appropriate medical attention and following the correct preventive measures.